something which comes from you having to walk or wade through the flood waters. And you know what I'm talking about. It is leptospirosis, or shortly called lepto. You all know that bigger cities are full of rodents, and it is these rodents that carry the transmitting agent of the leptospira, which is a spirochete, and it is passed in their urine, and this contaminates the floodwaters through which we sometimes have to walk. Many a time, particularly our females have to walk with either wearing sleepers or chappals or sandals, and males who might be walking with even with shoes might have abrasions, cuts here and there on their feet, on the legs maybe, and then the spirochetal organisms can find entry into the body because we have to wade through these waters. Now, a very common sight in Mumbai's range is children playing into these flood waters, which can be very risky, which can be very dangerous, and that can mean infection by leptospira. Why is leptospira a concern? In more than 90% of the people, it will be characterized by fever, headache, body ache, and they might get over and with medication come back home quickly. However, in a small fraction of patients, it can lead to damage to the liver, it can produce jaundice, it can lead to damage to the kidney, which might require dialytic support sometimes. Essentially, all this means a prolonged hospitalization, particularly in the ICU. Can be dangerous sometimes, and that is why we need to be careful about this. So, going out in rainwater, walking barefoot in floodwaters, particularly for those people who are having cuts, wounds, abrasions on their feet or on their hands and might have to have an exposure to such contaminated floodwater, have to be very, very careful.